Thank you for joining Women's Way's Summer Lunchtime Policy Briefing on the impact on women of the Supreme Court decision on the Affordable Care Act. I'm Amanda Aronoff, the proud Executive Director of Women's Way. This past winter, Women's Way launched this new biannual call-in series as part of our public education and advocacy programming as a way to build public awareness and support around various policy initiatives we are leading here at Women's Way. We are thrilled to have such a long list of people signed up for this call, over 85 people at last count, some of whom are newer to Women's Way, so please indulge me for 2 minutes before I turn things over to our Director of Public Policy so I can give a very brief summary of Women's Way for those who are newer. 2012 marks Women's Way's 35th anniversary, and for 35 years, Women's Way has courageously taken positions on cutting-edge issues relating to women and girls, engaging and convening people from all walks of life to create a truly collective and, as our mission says, powerful voice for women. Women's Way tackles many complex and intertwining issues: women's health, including the full range of reproductive and maternal health care, domestic and community violence, including human trafficking, specifically the sex trafficking of women and girls right here in our region, workplace equity and economic self-sufficiency for women, and the empowerment and leadership development of girls, just to name a few. We address these through 3 key programs. First, we make strategic grants to women and girls-serving organizations, investing critical dollars and technical support into community-based agencies that sustain families and uplift neighborhoods. Second, we lead proactive advocacy campaigns to influence policymakers and mobilize support to affect policies that matter to women, girls, and families. And third, our public education programming ensures a broad public dialogue by convening conferences and community forums, hosting issue roundtables and policy briefings, commissioning research reports, and producing think tank summits, all with the aim of keeping our finger on the pulse of the community and building broad public awareness. Our Lunchtime Policy Briefing is a new public education program for Women's Way, and again, we thank you all for joining us today. Originally, our plan was to use our summer policy briefing to discuss some of the public policy work we are leading around human trafficking and sex exploitation, and we do promise a call on that topic in the next year. But knowing this Supreme Court decision was on the horizon, and given Women's Way's work and expertise around healthcare reform, it became clear that we needed to talk about the impact of this monumental Supreme Court decision. Amazingly, as highly publicized as this decision has been, the latest poll numbers from the Pew Research Center say that 45% of respondents either didn't know what the court had done in regards to healthcare law or thought that the court had rejected most of the provisions of the law. So Women's Way felt it was all the more critical to use this briefing to help explain the decision and thereby hopefully also ensure that more women understand how it impacts them. So today's call will focus on the Supreme Court's decision to uphold the Affordable Care Act and how this decision impacts women's health. I should mention that Women's Way leads the coalition Raising Women's Voices of Southeastern Pennsylvania, which came together almost 3 years ago to ensure that women's voices were heard and reproductive health concerns were addressed during the health care reform debate. Now this coalition is advocating for implementation policies that support the full range of comprehensive reproductive health care services for women. Before I turn this over to Rebecca Foley, I have some brief housekeeping items. First, there will be time for questions towards the end of the call. If you have a question, please email it to klewis, KLEWIS, @womensway.org, KLEWIS @womensway, WOMENSWAY.org. So please email to that address during the call if you have a question. We will answer as many questions on the air as we have time for. Other questions will be answered after the call is completed by email. Second, this call is being recorded and will be posted on our website afterwards. And now I will turn the call over to Rebecca Foley. Rebecca has been the Director of Public Policy for Women's Way since June of 2008. Before joining Women's Way, Rebecca was the Education Policy Manager at Planned Parenthood League of Massachusetts. She has also worked for the chair of the Joint Committee on Public Health in the Massachusetts House of Representatives as a legislative aide and later transitioning to a policy analyst for the committee. Thank you, Rebecca.
Thanks, Amanda, and thank you all for joining us. Let me start off by saying we were overjoyed. Actually, we were literally jumping for joy when we learned at precisely 10:08 a.m. on Thursday, June 28th, that the Supreme Court announced its decision to uphold the health care reform law. This was a huge and historic victory for women and their families. But before I say why, I'm going to back up and talk a little bit about how this came about. Over 2 years ago, on March 23, 2010, President Obama signed into law the Health Care Reform Bill, officially titled the Patient Protection and Affordable Care Act, but often referred to as the Affordable Care Act, or sometimes even the ACA. The goal of the Affordable Care Act was to help people gain access to high-quality, stable, affordable health care that has been out of reach for so many, in particularly working families, women, seniors, and small businesses. Then, this past March, the U.S. Supreme Court took up and heard the case challenging the constitutionality of the Patient Protection and Affordable Care Act. It was actually 3 cases combined into one. We have limited time today, and we really want to focus on policy outcomes impacting women and not on the legal questions that were raised as part of this case so much. So if you're interested in the legal procedural issues that were raised around the Commerce Clause, the Anti-Injunction Act, and other legal issues that played a role in this case and in the decision, you can visit the National Health Law Program's website at healthlaw.org, and you'll find lots of great resources there. They've been a great partner. Or you can just email me at rfoley@womensway.org, that's rfoley@womensway.org, and I can send you plenty of this legal information. So to give a plain English description of the ruling that came down 2 weeks ago today, the Supreme Court decided by a 5-4 majority that the Affordable Care Act, including all its key provisions, is constitutional. The majority of the court found that the individual responsibility provision, otherwise known as the individual mandate, which is the requirement that everyone carry insurance or pay a fine, is constitutional under Congress's taxing power. The court also ruled that the Medicaid expansion, which expands Medicaid eligibility requirements for people below 133% of the federal poverty line, is constitutional. Although the ruling did limit what the federal government can do to require states to comply with the expanded eligibility requirements, meaning that states that refuse to comply with the Medicaid expansion will not lose the current funding they receive for the already existing, or you could say old, Medicaid program. I should mention that Medicaid is a joint program between the federal government and states, with the federal government making matching payments to states. I'm going to go more into the details surrounding this Medicaid ruling a little later. So now you may be thinking, what does this court decision really mean for women and families? Well, this historic law has already created many significant gains for women and their health, and millions of women and their families are already benefiting from the Affordable Care Act and will continue to do so now that the law has been upheld. For instance, younger women who are more likely to be uninsured than any other age group are already benefiting from a new rule that allows young adults to remain on their parents' health insurance until the age of 26, unless they get coverage from their employers. To date, 2.5 million young adults have gained insurance coverage under the law. This is particularly important in this tough economy where young people are having such a hard time getting jobs. Also, women now have more control over their health care as they no longer need to get a referral for OBGYN care. So we now have direct access to this type of critical care that we all need. The law makes it easier for new moms to breastfeed because large employers with more than 50 employees are now required to provide breastfeeding mothers with break time and privacy and a place to store milk. It is also giving mothers peace of mind by knowing that their children have health insurance, because insurers are now prohibited from denying coverage to children under the age of 19 because of a pre-existing condition. In addition, the law has abolished the practice of canceling policies of people who get sick. So insurance companies can no longer cancel policies of women who develop breast cancer or ovarian cancer or other illnesses. This was a practice known as rescission. Also, insurance companies can no longer place limits on the amount of money they'll spend on covered medical expenses. Women are more likely than men to suffer from a chronic condition, and an unforeseen medical emergency or chronic illness can cause someone to rapidly reach that cap in their plan, leaving that person with a huge with many unpaid medical bills. So under the law, lifetime coverage caps have been eliminated and annual limits are actually being phased out. About 39.5 million women have already benefited from the ban on lifetime caps. And women are currently benefiting from a preventative health care provision that allows us to get certain health screenings, such as mammograms, pap smears, other cancer screenings, without a copay or deductible. More than 45 million women have already taken advantage of these services, and many more will do so. So there are plenty more provisions that will greatly benefit women and their families, which will go into effect over the next couple years, and they will remain intact as a result of the Supreme Court's ruling. For instance, starting this August, so in a few weeks, actually 20 days to be exact, more key preventative health services will start to be available to women without copays and deductibles. These services include contraception, annual well woman visits, gestational diabetes screenings, breastfeeding supports, which includes rental of breast pumps, domestic violence screening and counseling, HPV testing, STI counseling, and HIV screening and counseling. Whew, that was a long list. Also, by 2014, insurers will no longer be able to deny women coverage due to pre-existing conditions, such as pregnancy, C-sections, or medical treatment for domestic violence survivors. Yes, that was happening in many states, and that will no longer be the case by 2014. Also, the practice of charging women more than men for insurance coverage, known as gender rating, will be abolished by 2014. Currently, women pay a staggering $1 billion more than men each year for the same health plans in the individual market. And up to 11 million women who lack affordable insurance through an employer and can't afford it on their own will be eligible for subsidies. In addition, in 2014, maternity care will be required in all new insurance plans. Coverage for maternity care is routinely excluded in the individual insurance market. In fact, only 12% of plans sold in the individual market even offer maternity coverage right now. Due to this provision, about 8.7 million women will gain guaranteed access to maternity care, which is fabulous. Finally, up to 10.3 million women could gain health care coverage that has been out of financial reach for them from the expanded Medicaid eligibility requirements. However, as I mentioned earlier, unfortunately, there was a downside to the Supreme Court ruling on the Affordable Care Act, which was in direct connection with the expanded Medicaid provision. So just to give a little background on Medicaid, prior to the Affordable Care Act, under the old Medicaid rules, only certain categories of poor people could qualify for Medicaid, such as pregnant women, parents with dependent children, the disabled, and the elderly. And the Affordable Care Act put in place a mandatory expansion for all states to include anyone under 133% of the federal poverty line. Just to put that into context, that is less than $15,000 a year for an individual and about $31,000 a year for a family of four. The federal government will pay most of the costs for these new enrollees 100% until 2016, and then 90% after that and beyond if a state does participate. But the Supreme Court decided that the federal government could not impose a mandatory expansion of Medicaid on states. Therefore, under the ruling, states have the option not to participate in the expansion, thereby leaving vulnerable populations, including many poor women, without health care. It is now up to governors in each state, it's really up to the governor's discretion, to decide whether the state will participate in this Medicaid expansion. At least 5 governors have been on record saying they will not participate. 9 states and the District of Columbia have actually said they are going to participate, and then many states are undecided at this time since this ruling only came out 2 weeks ago. Pennsylvania, our Governor Corbett, has not said either way. And millions of poor women could gain coverage from this expansion. Many of the women that will qualify are actually the working poor, those who are just barely making ends meet and whose jobs don't offer health care coverage or usually any benefits at all. We often hear from our funded agencies how much these women need health care coverage, but can't even imagine affording it when they need to pay rent and put food on the table for their children. If a state declines to participate in the Medicaid expansion, women will be hurt the most, as they are more likely to be poor than men. So, Women's Way and Raising Women's Voices will be working with advocates across the state to urge Governor Corbett to participate in the Medicaid expansion under the Affordable Care Act, and we will be sure to keep you informed on how you can get involved as we develop this strategy going forward. Now, I do want to tell you about a campaign that is currently underway that Women's Way and Raising Women's Voices is very much engaged in at the moment, the Countdown to Coverage campaign. This national effort is aimed at helping women understand the concrete ways that the health care reform law is making it easier for us to get the services we need to stay healthy through all our life stages and across all socioeconomic levels. We found that oftentimes it is hard to understand the tremendous strides this law is making for women because it gets caught up in all the political noise, which can really turn people off. So we're really trying to take healthcare reform out of that political frame where it just looks like a big, ugly fight, and helping women understand the value the law has for us as consumers of healthcare. There's also a great deal of misinformation and myths out there, and we are working to break through that noise and just give women the straight facts. By expanding healthcare coverage, putting in place important consumer protections, and making preventative care more accessible, this law really is making a difference in the lives of countless women and families. But women are extremely busy. I'm sure you can all attest to that. So just may not realize how they can take advantage of the benefits and services the new law has to offer. So through this national campaign, we are working to educate and spread the word to as many women as possible. We are getting out there at festivals, fairs, forums, conferences, and just speaking with as many women as we can to give them the tools to be able to take advantage of this new law. Another reason it is so important that we educate women on health care reform is because the vast majority of us are the primary healthcare decision makers for our families. In fact, women make roughly 80% of healthcare decisions for their family. So women really do need this information, not only just for themselves, but for their entire families. Currently, the Countdown to Coverage campaign is focused on the preventative healthcare provision. And we are counting down to August 1st, which, as I mentioned, is right around the corner, 20 days away, because on this date, all new insurance plans will have to start covering key preventative health services for women without copays and deductibles, such as the full range of FDA-approved contraceptive methods, breastfeeding supports, and screening and counseling for intimate partner violence, to name a few. Expensive copays are a major barrier for women, preventing us from getting the care we need. More than half of women have delayed or avoided preventative care because of its cost. And we know that preventative care leads to better health outcomes and can even save lives. You may recall that Women's Way and Raising Women's Voices fought hard for this important policy last summer, particularly the contraceptive piece, by conducting the successful campaign, Contraception is Prevention. We were working to ensure that the U.S. Department of Health and Human Services, under Secretary Sebelius, made contraception and these other critical preventative health services available to women without cost sharing or a copay. And it was a tremendous advance when women's health and our reproductive, it was just a tremendous advance for women's health and our reproductive health when we were successful. I do want to point out that this countdown will continue after August because there are many more pieces of the law that will benefit women, which will be put in place between now and 2014, as I discussed earlier. So the effort to build much-needed public awareness for the sake of women's health will continue, and Women's Way and Raising Women's Voices will continue to do this great work and engage in this campaign. I will talk about, in a few minutes, I'm going to talk about how you can support this effort. But first, I'm going to hand it over to Amanda.
Thank you. Okay, we have a couple of questions here. Okay, the first question we're going to go with is, let me read it out loud. I believe I read that there was an effort underway in Congress to repeal the Affordable Care Act. Is that true?
Great question. Yes, actually, although the Supreme Court did rule 2 weeks ago that the Affordable Care Act is constitutional, the U.S. House of Representatives voted yesterday to repeal the law. This was actually the 31st time they have taken this vote. This law, as we know from what I just discussed, is already helping millions of women. So these continued attempts to repeal it are very disappointing. But we do know, and we are assured, that the President will veto any bill that repeals this historic law if it does come to his desk.
Okay, a few more questions. Next, this one specifically about the work that you're doing for Raising Women's Voices. Okay. So, Rebecca, you mentioned that Women's Way leads the coalition Raising Women's Voices of Southeastern Pennsylvania. Can other groups join this coalition?
Another fabulous question that makes me very happy that someone's asking about getting involved with Raising Women's Voices. This coalition, like Amanda, you said, came together over 2.5 years, or a little under 3 years ago now. There are about 30 groups involved, and we are always looking for new coalition members to join our effort. The goal of this coalition is to make sure that women's health concerns are addressed and reproductive rights are protected as the health care reform law is implemented. And there is lots more work to do to implement the law, both on the federal level and on the state level. So we need your support, and would love to have more groups involved. Of course, we only want pro-choice groups to join. So if you are a part of an organization that may be interested in getting involved, we would love to have your support, and you can email me. That's probably the best way to get involved at rfoley@womensway.org. That's rfoley@womensway.org. And I would be happy to provide you with more information about how our coalition functions and what we are currently doing and what are the requirements for a coalition member.
Great. Okay, another question here, and this question I think is going to get into a little bit of what you're going to talk about in the next piece about action. And this is from a wonderful friend of ours. So the question is, how quickly will the strategy to influence Corbett's decision be ready to be executed? Time is of the essence, and the decision is not solely his anyway. What pressure will we be putting on the governor and the state legislators? We have to take action very quickly. And then there was another email along these lines about what are the action steps that we can do as individuals. Everyone's interested in the Medicaid. Another question said, what can we do as individuals to help try to influence the governor?
Right. So the strategy is being hashed out right now. Like I said, there are groups all across the state that are joining together to influence, to make sure that Governor Corbett and our state legislature does accept the Medicaid funding for the new Medicaid expansion. We are looking at the strategy right now and kind of finalizing it in the next, I would say, week or so, and then we'll be doing a lot of work, and we'll certainly be sending out action alerts, posting updates and ways you can get involved on our Facebook page. So we will certainly keep everyone in the loop on what you can do, and it will move in the next week or so. If you want to do something today, you can certainly write to Governor Corbett and explain to him why participating in the Medicaid expansion is so important to you, your family, and women across the state. Because as you you mentioned in your question, time is of the essence. So if you want to start generating some letters now, that would be great, and then you can tie into what we're going to be doing in the next week or so.
Great. We have time. I'm going to do this. I have another question here, and then I'm going to try to fit in two more that have come in. So here's the question: is there still an effort underway in the Pennsylvania state legislature to ban abortion in the new health care exchanges under the Affordable Care Act?
Yes, unfortunately. Here in Pennsylvania, we have been fighting numerous bills this legislative session and actually last legislative session too, that would prohibit abortion coverage from being offered by private health insurance plans sold in the new state exchanges that will be set up in 2014 as part of health care reform. The bills that we've been fighting this past year are Senate Bill 3, House Bill 912, and House Bill 1977. These bills would in fact ban private health insurance plans sold in the exchange from covering abortion services, even though the cost is paid entirely by the individual. The bill would ban coverage of even medically necessary abortions. The exceptions are very narrow, which are in the cases of rape or incest or to avert the death of a woman. There is no medical exception, not even for catastrophic health situations such as paralysis, organ failure, or infertility. So this legislation would have a devastating impact on women and families by really dramatically changing the status quo for abortion access in Pennsylvania by taking away critical coverage from thousands of women who will enroll in the exchange come 2014, which are women who are, those who will be participating in the health insurance exchanges are those who are self-employed, those who are unemployed, and work for small businesses and nonprofits. So we have been fighting this for, since the health care reform bill went into effect, we've been fighting this legislation, and we will continue to do so. We've been successful so far at making sure it doesn't pass because we've been keeping up a steady drumbeat to tell legislators this legislation will be dangerous for women in Pennsylvania. There's actually something you can do. I know I'm getting on to how you can make a difference, but it's important I mention this. There's actually something you can do, since you asked this question, to support our effort and oppose this legislation, which is by visiting Women's Way's website. There's an action center on Women's Way's website in our advocacy section, and you can send an email to your legislator opposing this very dangerous legislation. So again, it's on Women's Way's website, womensway.org. That's www.womensway.org. And up in our advocacy section, there's an action center. And right on the homepage of this action center, there's an alert you can take. There's an alert you can participate in, and you'll be sending an email to your legislator opposing this legislation. So if you haven't yet done so, please take the time to take that step.
So I think we really only have time for one more question, although I'm glancing through, and we have a couple of other great questions, and I promise that Rebecca will be following up with all of those individually after the call is through. But the last question is, how can healthcare providers educate both our patients and staff about the Affordable Care Act, and can Women's Way provide any resources?
Yes. Women's Way does have a great deal of resources we can share with healthcare providers. We're actually this summer been starting to engage with different healthcare clinics to try to get information out at clinics to provide the different information I talked about today to women that providers do see. So we would love to engage with you. Please email me, and we can talk further about this, and we can send you resources.
We have their email.
Oh, right, exactly. So I'm glad we have your email, and we'd be happy to engage in a dialogue about how to best go about this. But I really appreciate this question and think we could have some great synergies here.
And I just have to say, again, there have been a couple of fabulous questions that have come in that we just simply don't have time to answer. But Rebecca will be in touch with each of you individually. I see some great ideas that are coming to us by email. But before I want to, and now I just want to turn it back to Rebecca so she does have a few minutes to talk about ways you can take action, because at the end of this call, we want you to feel empowered that you can really be part of this effort moving forward.
Great. Thanks, Amanda. So just a few ways, like Amanda said, that you can get involved, and we've talked about a few, but here are a few more. First, tell 10 people you know about the Countdown to Coverage campaign. By spreading the word, that is really how women are going to learn about the great strides this is making. And you can find more information and fact sheets on the homepage of our website. Right on the bottom of our homepage, we have plenty of information about the Countdown to Coverage campaign. So tell 10 people. Another thing you can do is share your Affordable Care Act story with us. Stories can be very powerful. They give meaning to and context to easily forgettable facts. and there are a lot of facts that we've just talked about. So stories can really put this all into context. And as we educate women about the Affordable Care Act, it is really helpful for us to be able to use these stories. That's really the hook to get people interested. So this is why we are looking to gather stories and on how the health care reform law has helped women in our region. If you have a story that you'd be willing to share, there's a story form on our website right on the homepage in the Countdown to Coverage section, which you can easily fill out and return to us. The directions are all right there. So we do encourage you to share these stories. And if you know someone with a story, direct them to our website. We also can do a Countdown to Coverage presentation, which goes into the many gains this law is making for women and how women can benefit. So if you have a group of women that would be interested in such a presentation, a group of women that regularly meets or that you'd like to gather together, please email me at rfoley@womensway.org and we can set that up for you. Number 4, write a short letter to the editor of your local newspaper on why you are happy the Supreme Court upheld the Affordable Care Act. Certainly, the newspapers we're hearing from many groups and organizations, but it's really important for them to hear from individuals as well. Also, share the information you learned today with others. As Amanda mentioned, we are recording this call. So if you know others who may be interested in this topic, we will have this call posted by the end of the week and direct them to our website to listen themselves. We're just really trying to spread the word to as many people as possible. So if you want to tell your colleagues, your family, your friends, your neighbors about this information, direct them to our website and they can listen in on their own time. Also, join Women's Way's email list if you aren't already on it. I'm sure many of you are, but for those of you who aren't, we do send out a monthly newsletter and periodic action alerts, which I alluded to, which includes ways you can make your voice heard and you can get involved, as so many of you are interested in getting more involved in taking action. So if you don't receive our emails already, you can easily sign up on our website by clicking on the Subscribe to Female icon on our homepage. Our homepage is, again, womensway.org. I do sound like a broken record, but I want everyone to go to our website. And then lastly, just to put in a plug, we do have a Facebook page, and we do put regular advocacy updates on our Facebook page, timely updates. So if you are on Facebook, please like us, and you will be able to stay informed that way as well.
Great. Thank you, Rebecca, and thank you to everyone who's on this call for spending your lunch hour with us. Please stay tuned for future policy briefing calls, and if you still have questions that pop up, you're sitting around later today and you think of another question, please email them to us. We're happy to continue answering your questions. And, of course, as Rebecca said, to learn more about Women's Way, visit our website at www.womensway.org and be sure to like us on Facebook. And thank you again for joining us.
Thank you.